Welcome to Suhail's Paramedical and Nursing Academy. Today I am going to explain about the antihypertensive drugs. The today's lecture will be about the antihypertensive drugs. Before I am going to tell about the antihypertensive drugs, you have to remember about the what is hypertension. Then only we can understand why we are providing the drugs to the hypertensive patient. So why we are providing this type of drugs, this type of classification to the hypertensive patient. So remember what is hypertension. Hypertension is an elevation. Hypertension in a simple terms, hypertension is an elevation in the systolic and diastolic blood pressure. Systolic and diastolic blood pressure. The normal systolic and diastolic blood pressure is 140 by 80 mm of Hg in an average. So hypertension, first you have to remember what is hypertension. What is hypertension? So you can write in your notebook, hypertension is an elevation in the systolic and diastolic blood pressure. The systolic blood pressure is 140, there will be increase. The diastolic blood pressure is 80, it will be increased. 80 what? mm of Hg. Okay, so mm of Hg 140 by 80 systolic, this is diastolic, it will be increased. This is called as hypertension. So elevation in the diastolic and systolic blood pressure. Now the question may be in your mind, what is blood pressure? So the blood pressure is the pressure exerted by the blood on the vessels, on the arteries and veins. So remember here, in case of hypertension, this blood pressure will be increased. So there will be increased pressure on the blood vessels. And also when there is increased blood pressure on the blood vessels, so there will be what? And yeah, I will tell later, because at the first I will not tell that. So in case of hypertension, just you remember, there will be increased blood pressure, elevation in the systolic and diastolic blood pressure. The systolic and diastolic is given here. Now the drugs that we are going to provide are called as antihypertensive drugs that will be provided against the hypertension. First of all, what is the I will tell one more thing, that what is the mechanism of controlling hypertension in our body. In our body there will be a normal mechanism to control hypertension. What is that? For that, remember, you have to think what is the controlling mechanism of hypertension. Controlling mechanism of hypertension in our body, one is baroreceptors. Second are what? Second is ROS system. Baroreceptors. Second, ROS means renin, angiotensin, aldosterone system. These are the two things which are normally controlling the hypertension in our body. Now the thing is, in case of baroreceptor, what are baroreceptor? You will be confused. So the baroreceptor are these are what? Neuromuscular structures. Neurovascular sensitive structures. So the neurovascular sensitive structures which are present at the wire, two places these are present. One is called as arch of aorta. Another is called as one is arch of aorta. Another is what? Carotid body. Arch of aorta, carotid. What are these? I will explain more so that you will get in the mind. I told baroreceptors are neurovascular sensitive structures. What is their role? I will tell later. These are present at the arch of aorta or carotid bodies. What is arch of aorta? Remember, this is an ascending aorta. This is an This is an ascending aorta. That is coming from heart. That is coming from heart, and which further bifurcates into many blood vessels. Okay, so this is ascending aorta, and this will be the descending aorta that goes at the backside of heart. The aorta that runs from backside of the heart towards downside of the body. This is called as descending aorta. This aorta comes from where? The aorta arises from the left ventricle, so that the oxygenated blood will be transferred to the body parts. So this ascending aorta, this is ascending aorta, this is descending aorta. Here, this part is called as arch of aorta. This is called as arch of aorta. This arch of aorta is neurovascular sensitive structure. There is neurovascular sensitive structure at this part that acts as a baroreceptor. That is one thing. Another is called a carotid bodies. Remember one thing. What is that? This is a common carotid artery. We all are having the common carotid artery. The common carotid artery bifurcates into two arteries. It bifurcates into two arteries. One is, this is called as, this is remember common carotid artery. It will bifurcate into left common carotid artery. Okay, and this artery will be this. We have nothing with this artery. We will not go into the deep inside. Just remember, the common carotid artery bifurcates into two arteries. At the point of bifurcation, there is a body. There is a structure, a neurovascular sensitive structure that is called as carotid body. Which is having the baroreceptor. What is the role of these? What is the role of this baroreceptor? What is the role of arch of aorta? What is the role of carotid body, which are having the baroreceptor? What is the role? The role is what is their role? I will tell here. Remember the point that whenever there is decreased blood pressure, I am saying actually the mechanism of controlling hypertension. So whenever there is decreased blood pressure, our body will try to maintain the blood pressure. It will try to increase the blood pressure towards the normal. So what will happen? That these baroreceptors, these carotid arteries, these baroreceptors which are present at the aorta and carotid body, what they will do? They will stimulate sympathetic nervous system. You all know about the nervous system. I will not go in the deep here. So they will stimulate sympathetic nervous system. What is the role of sympathetic nervous system? What the sympathetic nervous system will do? It will do vasoconstriction. So now you understood, whenever there will be increase in the blood pressure in our body, this mechanism will take place, that the decreased blood pressure will activate the baroreceptors, which are neurovascular sensitive structures present at arch of aorta as well as at the carotid body. And when these bodies stimulate, these bodies stimulate the sympathetic nervous system, and there will be the vasoconstriction. This I am telling the mechanism of controlling the hypertension normally in our body. Another thing is that is called as ROS system, renin aldosterone angiotensinogen system. This system I will explain later when I will take the mechanism of ROS inhibitors. So if I take here, I have to explain this later also, how ROS system increases the blood pressure. So this was doing what? Vasoconstriction, so that the blood pressure will be if there is decreased blood pressure, it will increase blood pressure by vasoconstriction. ROS system do what? It will absorb the more and more sodium, it will absorb more and more water, it will excrete the potassium. What will happen? The blood pressure will be increased. So it will also increase blood pressure. It will increase the blood pressure. But here it has decreased the blood pressure. So these two systems are controlling increased blood pressure as well as decreased blood pressure in our body. This much you have to remember. This is the controlling mechanism of hypertension. Actually, now we are talking about the hypertensive patient. The patient who is having the hypertension. You can take the screenshot of this. If anyone want, can take. Baroreceptors. Anyone want to take the screenshot? Then I will rough this. Okay. Now I will explain about the classification of antihypertensive drugs. What is the classification? What is the classification of antihypertensive drugs? Remember, to remember the classification of antihyper drugs, you have to remember about the one mnemonic, that is cardiovascular. Cardiovascular. We all know cardiovascular. Hypertension is an cardiovascular disease. It is actually a vascular disease. What it is related to the cardiovascular system. That is why we call it as cardiovascular disease. In this so remember the mnemonic cardiovascular. Now I will tell the drugs. So there will be one drug, C for calcium channel blockers. C for calcium channel blockers. Okay. A for 2. One is angiotensin converting enzyme inhibitors. Another is angiotensin second receptor inhibitors. So one is C for calcium channel blockers, and A for angiotensin converting enzyme inhibitors. Angiotensin second receptor blockers. Second receptor blockers. Then the third will be what? This is the D. This was C, this was A, this is D. D for diuretics. D for diuretics. Then V for vasodilators. Vasodilators. S for sympathomimetics. Sympathomimetics. That we are calling as beta and alpha receptors. Beta and alpha receptor blockers. So this is the classification. After that I will tell the drugs which are coming in. At least you remember this. One is C, calcium channel blockers. Another is A, ACE inhibitors, angiotensin converting enzyme inhibitors. Angiotensin second receptor blockers. These are the two. Remember. One. See, this is 2, this is 3. This is 1. This will be the fourth. Fourth will be the diuretics. D for diuretics. Then V for fifth will be vasodilators. Then S for sympathomimetics. So 6 classification I have told you. Now I will tell the drugs which are coming in this classification. At least you remember this is the mnemonic. You can take the screenshot. I will tell the drugs which are coming in this. Okay. So the first classification I will tell here. Okay. The first classification I told first I will take diuretics. Today is general I am taking the diuretics generally. Then later I will explain the most thing that I will explain the detail will be ACE inhibitors, because in the examination they will ask mostly about the mechanism of angiotensin converting enzyme inhibitors. So let us come to the point, that is diuretics. Let us come to the point, that is first diuretics. In diuretics you have to remember there are many classifications. There are many. I want to rough this. Anyone want to take the screenshot can take. Okay. I want to remove this much. Okay, I will keep that. This much I will keep. So in the diuretics, first is loop diuretics. What is the example in the loop diuretics? You can remember. In case of loop diuretics, the example you can remember furosemide, torsemide. Anyone want can remember more examples in the books already given. So two loop diuretics, example furosemide, torsemide. Second is after the loop diuretics, another I will tell that is thiazide diuretics. One second, whether the lecture is going on. Yeah. Thiazide diuretics. So in thiazide diuretics, you will remember two drugs. One is hydrochlorothiazide. Hydrochlorothiazide. Another is chlorothiazide. So chlorothiazide comes under the thiazide diuretics. Then I told in case of loop diuretics, there are two drugs, furosemide, torsemide. Another the thiazide diuretics. There is hydrochlorothiazide and chlorothiazide. Then the third classification, that is potassium spartic diuretics. Potassium sparing diuretics. In case of potassium sparing diuretics, you can remember that. What is the example in the potassium sparing diuretics? Remember the example is spironolactone. Okay. So this is the example in the potassium. Then one more classification is there. Two classifications are more. I will tell the classification. This was potassium. Then I will tell one more classification. Here are more. Two classifications are more. Here I will tell. I am telling the classification of diuretics. Fourth classification will be carbonic anhydrase inhibitors. In the carbonic anhydrase inhibitors, what will be the example that you will remember? That is acetazolamide. Acetazolamide is the example in case of carbonic anhydrase inhibitors. Is there any more classification? Of course, there is one more classification, that is osmotic diuretics. Okay, in case of osmotic diuretics, what example you will remember? The example you will remember is, that is, you will remember urea. You will remember glycerol. Urea. You will remember glycerol. You will remember one more, that is mannitol. These are the osmotic diuretics. So diuretics is in loop diuretics, thiazide diuretics, potassium sparing diuretics, carbonic anhydrase inhibitors, osmotic diuretics. Examples are given here: furosemide, torsemide, hydrochlorothiazide, chlorothiazide. Here spironolactone. Here acetazolamide. Here urea, glycerol, mannitol. This is the diuretics and their classification. Now I will move to the next part. So you can take the screenshot once more. I am giving the chance, you can take the screenshot about the loop diuretics. I will take the second classification. What will be the second classification? That is which is the most important. The second classification, which is the most classification, is ACE inhibitors. First I will check whether the video is running or not. Yeah. Where I have kept the duster? ACE inhibitors. In case of ACE inhibitors, you remember the two drugs: captopril, enalapril. You can remember more drugs, but just I am telling here at least two. That is captopril, enalapril. But if you remember two also, that is more than enough. But just to remember the captopril, enalapril in case of angiotensin converting enzyme inhibitors. Then there is second classification. I told angiotensin second receptor blockers. What is the example in the answer? One is condensatin. Whether it is the same example is there or not. You can also check whether it is condensatin or something. I have confusion here. Condensatin. First I will check whether it is the same or anything else. Yeah, it is condensatin. Another is losartan. Okay, at least two drugs to remember. Condensatin and losartan comes in the angiotensin second receptor blockers. This was all about the AC inhibitors. This was all about the AC inhibitors and angiotensin second receptor blockers. Okay. Now I will move to the third classification. Fourth classification. What is the another classification that is remaining? Suppose vasodilators. What is the example in the vasodilators? You can remember nitroprusside sodium. Nitroprusside sodium. Okay, nitroprusside sodium comes under the vasodilators. There are some oxides also you can remember. What is the one more classification? So this was all about the vasodilators. You can remember here one more example, that is hydralazine. Actually, sometimes I am forgetting the drugs to remember here. So hydralazine, because these drugs you will only remember them when you continually revise this. Everyone needs this, even though if he is the teacher, he needs the revision for the drug classification to remember the drugs in the separate classifications. So hydralazine, nitrosodium peroxide comes under the vasodilators. The last one is sympathomimetic. Okay, I will write here. The last one is sympathomimetic. Sympathomimetics. Where is the duster? So in sympathomimetics you will remember at least two drugs. Sympathomimetic is propranolol, metoprolol. At least you can also check the book whether the drugs I am putting in the classifications are right or wrong. Sometimes I am thinking something different, but here I am putting something different. That you have to check in the book also. That is your work. Sympathomimetics includes propranolol and metoprolol. So this was all about the classification of antihypertensive drugs. Mostly I will tell the mechanism of angiotensin converting enzyme inhibitors. Okay, the example is captopril. So the angiotensin converting enzyme inhibitors mechanism is important. Then after that, what I will do, I will tell the simple mechanism of these others also. Okay, let us start today's topic. That is, I will rough this, okay, so that I will be able to show all the things very easy. So today's topic is, be attentive. This is the important. This mechanism is very important. That is mechanism of ACE inhibitors. How ACE inhibitors are working. In this, you will get the clear idea about renin, angiotensin, aldosterone system. The clear idea you will get after knowing this graph, that after knowing this sequence that I am going to provide. What happens actually? I will start from the basic. Whenever there is decrease in the blood pressure, so whenever there is decrease in the blood pressure in our body, what happens? I am telling this is Ross cycle. I am telling the raw signal. Then I will tell about how AC inhibitors work. Why are they work? First you have to know about the raw system. The raw system is here. I am going to draw here the raw system. So decrease in blood pressure. Decrease in blood pressure will occur in case of, why it occurs? Because of decreased blood sodium level, blood sodium level, or here or decreased what? Decreased blood sodium or decreased water concentration in blood. So either decrease in the water or either decrease in the sodium will lead to the decrease in blood pressure. What actually will happen when there is decrease in the blood pressure? What will happen that in our kidney we have the two kidneys, or everyone is having two kidneys. Okay, the kidneys will, what will happen when there is decrease in blood pressure? The kidneys are having what? A special type of cells within the kidney which will sense that there is decrease in blood pressure. When the kidney sense that there is decreased blood pressure, what will happen? That there is decreased blood flow towards the kidney. What happens? The kidney secretes renin. The kidney secretes renin. When the kidney secretes renin, what will happen? The renin has role in the conversion of angiotensinogen into angiotensinogen first. It has into the angiotensin first. So when the kidney secrete renin converts angiotensin into angiotensin first. Remember, this angiotensin is already present in the blood. It is produced by the liver. The liver already produces in the blood. It is already present in the blood. Liver produces angiotensinogen, which is already present in the blood. This angiotensinogen is actually an inactive form. It is an enzyme, but this angiotensinogen does not work. It is an inactive form. Like you are studying in the digestive system, there are enzymes produced. Enzymes are produced in our body, but those enzymes are produced in an inactive stage. Then they become active in their respective pH, in their respective locations. Okay, so I am telling about the angiotensin, which is an inactive. It is not active now. Renin is produced by the kidney. This is already present in the blood. But now kidney has produced renin when there is decrease in blood pressure. When renin is produced, it will convert angiotensinogen into angiotensin first. Now angiotensinogen first, it will be converted into what? It will be here. I will show here. It will be converted into angiotensin second. Angiotensin first will be converted to angiotensin second. Here the enzyme required will be angiotensin converting enzyme. This, it is produced by what? It is produced by the lungs. It is also already present here. Lungs already produce angiotensin converting enzyme that has role in the conversion of angiotensin first into angiotensin second. Remember, only how the change occurs, that is the production of renin. This was also already present, this was also already present. When renin is produced, renin converts this into this. This is converted into this by means of AC inhibitor. Now, what is the role of angiotensin second? Remember, what is the role of angiotensin second? The angiotensin second has a very important role. It has a very important role. What will it do? Angiotensin second, it will act on the kidney. It will act on the kidney to produce, I think it is better. And you all know this is angiotensin second. I will tell this here. Okay, here I will tell. Angiotensin second, what it will do. Okay, just remember here. Okay, here Angiotensin second, it will act on the kidney. It will act on the kidney to produce. It will act on the kidney to absorb, to absorb, to reabsorb, to reabsorb, to reabsorb more water and more sodium. It will act on the kidney to absorb more sodium and more sodium and water. It act on the adrenal gland to produce aldosterone. The role of aldosterone is two. Aldosterone will do sodium absorption, but potassium excretion. Okay, see, angiotensin second will act on kidney to reabsorb more and more water and sodium. It will absorb more and more water of sodium, and also it will act on the adrenal gland to produce aldosterone. The aldosterone has role in the absorption of more and more sodium and excretion of potassium, and it also acts on the pituitary gland. What will happen when it acts on the pituitary gland? There is an hormone which is already there stored. It is already stored there. That is called antidiuretic hormone. That antidiuretic hormone will be also produced. ADH. The role of antidiuretic hormone is also reabsorption of water into the ascending and descending cannulated tubules which are present in the nephron. So this was the role. This is the mechanism of ACE. This is a ROS mechanism. Now I will tell how the ACE inhibitors work. Here was ACE, angiotensin converting enzyme was there. Now we will provide captopril. The captopril is an angiotensin converting enzyme inhibitor. It will inhibit this setup. When it inhibits this setup, this conversion will not occur. When this conversion will not occur, this all will not occur. So that means there was absorption of sodium, absorption of water, excretion of potassium. Due to which there was an increased blood pressure. But now when we have inhibited this ACE inhibitor, this process will not occur from this setup. What will happen? That there will be decreased blood pressure. I hope you understood the mechanism of ACE, how ACE inhibitors act, and this system is called as ROS system. ROS means renin, aldosterone, angiotensin system. Okay, you can take the screenshot and you can write in your own words. I think no any teacher can explain this in more simple terms than this I have told, because I have told this in a very simple form. In books it may be more complicated. Just remember like this, it will be easy for you. And this was all about the angiotensin converting enzyme inhibitors, how they work, that I have already told here. Now I will tell about, you can take the screenshot. Now I will tell about other drugs, but I will not tell the broad mechanism. Just as simple things I will tell. Suppose there is one more classification. That classification is one more classification was there. That is diuretics. I told you there are different types of diuretics. Okay, I already told in the previous class the classification. The diuretics will be what? Di means diuretics. That means they will increase the urination. They will increase the removal of excretion of water. When they remove that means they will increase tubular water and sodium excretion. So the tubular sodium and water excretion will be increased by the diuretics. And how they act? What is the mechanism behind this? The diuretics will act on the ascending. There are two types. One is called a loop diuretic. If it is the loop diuretics, they will act on the ascending loop of Henle. They will act on the ascending loop of Henle to absorb more and more water. And if it is a thiazide suppose if it is a thiazide, what it will do, thiazide, it will act on the distal convoluted tubule as well as and collecting duct. Distal convoluted tubule, it will act as well as collecting duct, so to reabsorb more and more water. So water will be more reabsorbed. This water will be more reabsorbed, as well as sodium will be also more reabsorbed. Because in the urine formation there are three steps. One is called as tubular, one is called as glomerular filtration, another is tubular reabsorption, and the third step is tubular excretion. The tubular reabsorption is responsible for the accumulation of water, for the increase in the water in the blood, as well as to increase the sodium within the blood. This was a general mechanism. If they asked, suppose, about diuretics, you can make this SM in a graph-like structure and you can put as a mechanism. Okay. Then another is, suppose, I will tell about the calcium channel blockers. The third is calcium channel blockers. Okay, the calcium channel blockers. In the calcium channel blockers, you have to remember that they will block these kind of drugs will block the voltage gated calcium channels why it blocks in the smooth muscles of arteries and veins. The smooth muscles which are present in the arteries and veins are having the voltage gated ion channels, voltage gated calcium channels. They will be blocked by the calcium channel blockers, due to which there will be vasodilation. Due to which there will be vasodilation. Okay. Now this was all about the calcium channel blockers. I am telling the simple terms only. Calcium channel blockers will block the voltage gated ion channels which are present in the smooth muscles of arteries and veins. What will happen when these channels will be blocked? That the calcium will not move into the cell. When calcium will not enter into the smooth muscle cells, what will happen? Vasodilation will occur. When vasodilation will occur, blood pressure will be decreased. Okay. Now this was all about the calcium channel blockers. I told here, see, cardio. I told calcium channel blockers. I told diuretics. I told angiotensin converting enzymes. I told angiotensin second inhibitors. I told vascular. I told about the vasodilator. Now it is vasodilator. Then sympathetic. What will be the vasodilator? Dilator. I already told that example that someone was asked what is your name, and that person told my name is Beauty. So the opposite person told that your face itself says that your name should be Beauty. So from here the vasodilator will do, what are those? They will do vasodilation. How they will do vasodilation? There is no need to remember here mechanism in case of angiotensin, anti-hypertensive drugs. But if I got the time in the separate lecture, I will explain any time about how they work, how these vasodilators work, how they do vasodilation, how they dilate the blood vessels, that is veins and arteries. Okay. Now another classification is sympathomimetic. In case of sympathomimetic, remember there are one beta 1 blockers. Beta 1 blockers. Another are called as another alpha blockers. And there is third classification also there, which are both beta 1 and alpha blockers. And remember the point that beta 1 block, actually these are the beta 1, these are the receptors which are present in the kidney, which are present in the blood vessels. When these receptors which are present in the blood vessels, which are present in the kidney, when these receptors are blocked, because these receptors have role in the vasoconstriction. When these receptors are blocked, there will be vasodilation. Just for the purpose to remember that you should remember, I am telling, otherwise beta blockers is a long classification. Beta blockers, alpha blocker, that I have to explain the separate thing separately. But here just remember that they have role in the, that these beta receptors and alpha receptors have role in the vasoconstriction. But when we are providing the blockers, the blocking agents who block these beta 1 and alpha receptors, there will be vasodilation. I hope that I have told the all things of in case of mechanism. Now I will tell one more thing. I forgot that is adverse reaction. But here I will tell the adverse reactions of, remember, the adverse, in case of adverse reaction, I will tell adverse, whether the video is running or not. Yeah, video is running. Just I will tell in the simple terms, adverse reactions. What are the adverse reactions of angiotensin converting enzyme inhibitors? I already told that angiotensin converting enzyme inhibitors are important. So if the question was asked specific about the angiotensin converting enzymes, that time you can put these. What is the, how you can, I will tell mnemonic. Mnemonic is captopril. The drug that comes under the angiotensin converting enzyme inhibitors is captopril. So adverse reaction is also related with the captopril. How? C for, you can remember, in case of this, C for is cough. There will be coughing, one adverse reaction of these. You can P for neutropenia. That is decrease in the number of neutrophils in the blood. That is neutropenia. L for loss of appetite. Loss of appetite. And I for itching. There will be I for itching, L for loss of appetite, P for neutropenia, and C for there will be coughing. And there are more terms here. And one more you can remember, there will be hypotension. There may be chance of hypotension. Okay, and anything more to remember? Loss of appetite. P for proteinuria. There will be proteinuria. Proteinuria, that is presence of urea in the presence of protein in the urine. That is called proteinuria. Okay. And at least you remember 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 6 you remember in the adverse reaction of angiotensin converting enzyme inhibitors. Okay. And I think there is one more about this A. Just I will confirm what is this A. What is the A here? A is, yeah, A is angioedema. A is angioedema. Angioedema means, angio means blood vessel, edema means accumulation of fluid. So there is the accumulation of, there is the blood vessels will be swelling of blood vessels. We can remember as swelling of blood vessels is angioedema. And one more thing is T. T means loss of taste. So adverse reaction of angiotensin converting enzyme inhibitors. C for coughing, A for angioedema, P for proteinuria, T for loss of taste, O for let us leave O, P for neutropenia. Here is P, that is why P for neutropenia, I for itching. L for loss of appetite. I hope you understood about the adverse reactions of AC inhibitors also. If anything is remaining yet in the antihypertensive drugs, in the next part I will take that also. If there is no requirement to take one more part for this, then I will take any other topic.